Great.
Hi to our TRIAD group, Sergeant Bender here, and I have a guest for our October-November meeting. We're a little behind on our October meeting, but typically we do a Medicare update, and we have Loretto with us. Loretto is from the Northeastern Illinois Agency on Aging, and she is kind enough to share her knowledge with Medicare updates with us. So Loretto, thank you for being here. She is going to provide some information. She has a PowerPoint and some other information I will also email to all of you. So Loretto, if you want to go ahead and start, thank you so much for being here and doing this for us.
Oh, I'm grateful for the opportunity. The more people understand about Medicare, the better off they will be in terms of their health and their finances and their peace of mind. So this is a trifecta of information that I hope will be useful to you. This is the season when Medicare is on our minds because we're in the Medicare open enrollment period. That occurs every year from October 15th to December 7th. And this is your annual opportunity to review your current situation and decide whether you want to stay with your current drug plan or Medicare Advantage plan, or switch from one to another, or go from Medicare Advantage to traditional Medicare, or vice versa. Lots of things you can do during this period. Most of the changes that you might make now, from now until December 7th, would take effect on January 1st of next year. Now, this is for people who are already on Medicare. This is not the enrollment period for new enrollees, people who are just turning 65 or just about to. They have a different timetable, which we don't have time to discuss now, but I'll be happy to talk with them individually. So first, let's look at drug plans. One of the handouts that Leanne is going to email to you is a list of all 31 drug plans that will be offered in Illinois next year. There are 28 this year, so we've got 3 new ones. The premiums, the monthly amounts, range from $7.30 up to $147.80, a huge range in monthly premiums. The maximum deductible will be $445, a $10 increase from this year. But many plans waive the deductible for all generics or for at least preferred generics, so it doesn't necessarily apply to everything that you might take. You should have received what's called the annual notice of change if you're already in a drug plan. They should have sent that to you probably in late September. And that tells you what that plan's premium and deductible and formulary and so on will be for next year. So at a bare minimum, look at that closely and see how it would affect the drugs that you know you're likely to take next year. Every year, the plans can change their premium, deductible, formulary, that's the list of drugs that they cover, the co-payments for each one of those drugs, any usage restrictions that they impose, such as quantity limits or requirements for prior authorization or step therapy, and the list of preferred and non-preferred pharmacies, which can make a big difference. So with all these variables, how can you figure out which would be your best choice? That's where the Plan Finder comes in, as shown on the next slide. The Plan Finder is the tool on the Medicare website, medicare.gov, and it is the only absolutely objective source of information for drug plans and Medicare Advantage plans for next year. The Plan Finder is not trying to steer you to any particular plan. It just wants you to have the information so you can make a well-informed choice. It tells you what the total cost would be for your list of drugs, the total for the year, and then the cost by each month, the cost for each drug, any usage restrictions, what your pharmacy options are. All this information is available. Once you've made your mind up, you can enroll through the Plan Finder online, or you can call Medicare and they will do it for you, or you can enroll by calling the plan or on the plan's website. Using the Plan Finder does not commit you to anything. It just gives you a good cost estimate, a very objective cost estimate. If you tried to do this calculation on your own, there isn't enough scratch paper in the world on which to do it, even if you had all the information. And you don't have all that information, but the plan finder does. So I urge you to do that. It's a little bit complicated, but you can work your way through it. Or if you hit a snag, there's a lot of help that's available. On the next slide, it shows that you can go to Medicare.gov and click on Find Health 2021 Health and Drug Plans, and that's where you start. If you already have what's called a My Medicare account, you can enter your username and password, and it will give you a list of all the drugs you used this year. If you don't have such an account, you can establish one online. Or if you don't want to, you can enter the list of your drugs that you take. You need to give the name of the drug, the dosage, and the frequency, such as lisinopril, 20 milligrams, 1 a day. If you use the generic, don't put the brand name. If you use a brand name, don't put the generic, because that will gum up the price calculations. You can also choose up to 5 pharmacies in your area, or mail order and 4 pharmacies, and that will tell you which plans are have a cooperative relationship with which pharmacies. That can make a huge difference in the total cost that you would pay. The plan finder will then list all the plans, all 31 plans, in ascending order of total price. The total price is the premium per month times 12, plus all your co-payments throughout the year. And it gives you a lot of other information too. So you could look at that for all 31 plans if you want, but really only the first 2 or maybe 3 are of any interest, because why would you want a plan that would charge you more for the same drugs? The next slide tells you about extra help, which is, oh, I skipped one. Excuse me. The next slide is about how to actually enroll. If you are interested in remaining in your current plan, you don't have to do anything. You will automatically be re-enrolled for 2020. If you want to switch or enroll for the first time, you can either call the plan you chose or call 1-800-MEDICARE, or enroll on the Medicare website or on the plan's website. So you've got lots of options. Be sure to name the plan correctly. Many of the plans have similar names and it can be confusing. It wouldn't hurt to use the plan number, and that is listed on that handout that Leanne is going to send you. You can decide how you want to pay the premium. Either send the plan a check every month, and if you choose that, they'll give you a book of coupons to enclose with your check. Or you can direct the Social Security Administration to withhold the premium every month from your monthly benefit, and they'll send it directly to the plan. Or you can authorize your bank to withhold or to withdraw the amount and pay it automatically. It's your choice. Usually enrollments will be for a full year, all of 2021, but there are some cases in which you get a special enrollment period. For instance, if you lived in Illinois and you moved to another state, you could get a special enrollment period to choose a plan there. The low-income subsidy in the next slide is a federal benefit that provides what's known as extra help, a subsidy for people with very limited incomes and assets. The current income limit is $19,140 for a single person. For a couple, it's $26,000. It will be announced. If you think you qualify for extra help, apply through the Social Security Administration. You can do it online. Of all those 31 plans next year, 10 of them will have no premium at all for people who are receiving extra help. And in all of the plans, no matter which one you choose, you will have very low co-payments. Another little benefit for extra help recipients is that they can switch plans up to 3 times in the course of next year, once each in the first 3 quarters of the year. The alternative to traditional Medicare is what's called Medicare Advantage, and that is managed care alternatives to traditional Medicare A and B. Medicare Advantage is offered by a variety of insurance companies that contract to serve specific geographic areas. For instance, a plan might contract to serve Cook County, DuPage County, and Will County. So you live in Will County, you could join that plan if you wanted. I, who live in Kankakee County, could not join that plan, even if all the doctors and hospitals I was likely to use were in Will County. It depends on where you live. There are 49 Medicare Advantage plans in Will County next year. So if you're interested in joining, there should be one or several among those 49 that might be a good fit for you. Medicare Advantage plans have to offer all the benefits of traditional Medicare, and they may offer extra benefits. The most common extra are vision or dental care, enrollment in a health club or a gym or something like that. However, be sure to read the fine print about those extra benefits. I frequently get phone calls from people who say, I want that plan I saw advertised on TV that covers all my dental and vision care. And I have to caution them, it may not be quite as good as the ad made it sound. Read the fine print. Maybe it has a dollar amount per year that they will cover, or only specific services, or maybe you have to go to a particular dental clinic or optometrist. Just read the fine print and know exactly what you're getting. In any case, those benefits are not things that you would get in traditional Medicare, but still it may not be quite as good as the ad made it sound to the casual listener. The basic information about Medicare plans, Medicare Advantage plans, is offered on the Plan Finder, but you may need to do further research. One of the most important considerations is who is in the network. So let's talk about networks and preferred providers in the next slide. An HMO is a health maintenance organization that has a network of providers. Certain doctors, certain hospitals, certain other providers are in that network. In an emergency, you can go anywhere, but for non-emergency care, you have to use that network. If you go to someone else or some other hospital, the plan will not cover it at all. In an HMO, you usually have a primary care doctor, and only with that doctor's referral can you see a specialist. It may also require prior authorization for some care, such as surgery or special procedures that can be costly. So again, it's important to understand exactly what the rules are. If you're in a Medicare Advantage plan, you are getting your care through that plan, and you have to follow their rules, not the rules of traditional Medicare. An HMO is the most rigid. An HMO point of service gives you a little more flexibility because they will cover some out-of-network care at higher cost to you. So one of the first things you want to find out is if, for instance, you see Dr. Smith, he's your primary care physician, and you want to stay with Dr. Smith, that's the first thing to ask. Is Dr. Smith in this plan's network? Furthermore, if you see not only Dr. Smith, but also Dr. Jones, a specialist, now you want a plan that has both Dr. Smith and Dr. Jones. If you see half a dozen specialists, it gets trickier to find one plan that includes all of them. On the other hand, if it's not important to you to stay with those doctors, then that's not an issue. The other major type of Medicare Advantage plans is preferred provider organizations in the next slide. PPOs are a little more flexible than HMOs because, as the name implies, they have preferred providers, but it's not a rigid network. Someone who is not a preferred provider will still get some coverage from the plan. So you want to find out exactly how much will they pay and also who is on the list of preferred providers. PPOs don't usually require referral to see a specialist, but again, it's very important to understand what the rules are and exactly who is in the network. Next slide explains that one of the big advantages of Medicare Advantage is that it has out-of-pocket cost limits. In traditional Medicare, there isn't. In an HMO or a PPO, though, there are limits for either in-network care or a total for care both in and out of network. In a traditional Medicare, you probably need a supplemental policy, also called Medigap, because there is no limit on your cost. In a Medicare Advantage plan, because there is such a limit, you don't need a Medicare supplement, and in fact, by law, you are not allowed to have one. So that's a big monthly expense that you don't need to make if you're in Medicare Advantage. Evaluate any Medicare Advantage plan carefully for the care that you're likely to need. You can pretty well anticipate the care that you'll need just routinely if nothing major arises, but also consider the possibility of unforeseen needs. This time last year, for instance, nobody anticipated the possibility of COVID, and look how that has disrupted the entire medical practice and our own individual needs. We don't know what's going to come up next year. The nature of all insurance is to provide protection against the unpredictable, especially the catastrophic unpredictable. So keep in mind, you don't want to just look at what costs you would pay for services that you'll know you'll need. Look at what you would pay for something that you are not certain, something that you hope you won't need, but you might. Most Medicare Advantage plans cover prescription drugs, but not all. If you're in a plan that doesn't cover drugs, you can join what's called a standalone drug plan. Now, I mentioned Medicare supplemental policies, so let's talk about those a little more. This is an optional insurance that you can get if you are in traditional Medicare A and B. It's offered by private companies, not by Medicare itself, and it is regulated by both state and federal law. Under federal law, Medigap policies are standardized. They are labeled A, B, C, and so on. Standardization means that an A policy is identical no matter what company you buy it from. So an A from Blue Cross, or an A from Aetna, or an A from Humana, or from United Healthcare, or anybody else, it's exactly the same. Everybody's B is exactly the same as everybody else's B, and so on. But the prices are not the same. The premiums are not standardized. The plans are free to charge whatever they like, knowing that they are in competition with one another, and they can vary significantly. A very important protection for Medigap is that policies cannot be canceled as long as you pay the premium. They could not say to me, "Oh, Loretto, you've been hospitalized 4 times and you've had 2 heart attacks and you've recently been diagnosed with cancer and diabetes and Parkinson's. We're losing money on you. We have to drop you, or we have to raise your rates." They cannot do that. They can raise rates for everybody in the age group or across the board, but they cannot single me out for a higher premium, and they cannot cancel my policy. When you choose a Medigap policy, choose it for the long haul. For Medicare Advantage and for drug plans, we want people to review it every year and be prepared to switch if they would save a lot of money. But for Medigap policies, at the outset, choose the plan that is a reasonable balance between protection and what you can afford, and then expect to stick with it for a long time, probably for the rest of your life. The next slide is small, but it gives you the information that's also in the Medicare and You handbook. And that is, it tells you what each of those standardized policies covers. Even if you can't read it very well, you can see that the A policy in the first column on the left covers the least. And of course, it also costs the least. The F policy covers the most and costs the most. And then there are several other combinations of benefits in between those two. There is a wonderful guide to Medigap policies put out by the Illinois Department on Aging, the Senior Health Insurance Program. And it has the title of the Medicare Supplement Premium Comparison Guide for 2020-2021. And you can see it online on the Department on Aging website. It is invaluable because it tells you in more detail what each one of these policies cover. It gives you sample rates for every company in the state that sells the insurance, and it explains a lot of other important information, such as guaranteed issue, which is in the next slide. Guaranteed issue is the assurance for new Medicare enrollees that they can get whatever policy they want from Medigap companies, from any company they want. But it only applies in the first 6 months that you are enrolled in both Medicare A and B. During that time, you can choose any company, any policy, and they cannot turn you down, no matter what your current health or your health history. After that 6 months, you may be able to get a Medigap policy or to switch from one plan to another or one company to another, but you don't have a guarantee of it. The company may require medical underwriting, they may turn you down. So that's why we want people to choose a plan for the long haul while they are in that initial 6-month period, and then anticipate that you will stick with it for a long time. People who have enrolled in Medicare since the first of this year, 10 months ago, cannot buy a C or an F. But if you look at that table that we saw a few slides back, you'll see that they can get a D or a G, which is just as good, except that D and G don't cover the Part B deductible of $198. This is kind of inside baseball. But frequently D and G are less expensive by more than $198, so they really are a better buy. Again, I urge you to look at that Medicare supplement guide that's on the Department on Aging website for a lot of details that I'm going through rather quickly. The next slide is a disappointment to me. I had hoped that we would be able to fill in all these blanks, because this is what you most want to know, the costs for next year, and Medicare hasn't announced it yet. Unless they've done it within the last half hour, we still don't know what this will be. The Part A premium, most people do not pay. Because you or your spouse probably paid the Medicare payroll tax during your working lifetime, you don't have to pay that. So don't worry about that for next year. The Part B premium this year is $144.60. We don't yet know what it will be next year. My guess is it will go up $4 or $5, but that's just a guess. That's the amount that is withheld in most cases from your Social Security monthly benefit. If you don't yet receive Social Security, it is billed quarterly to you. The Part A deductible this year is $1,408. We don't know what it will be next year. But there's a tricky part of this Part A deductible. It is not an annual deductible, it is per benefit period. You pay this deductible if you are admitted to the hospital as an inpatient. If you just go for an outpatient procedure, or you need stitches at the ER, or all kinds of things like that, and then you go home a couple of hours later, you haven't been admitted. But if you are admitted as an inpatient, you pay the deductible, $1,408. And that covers you for your entire hospital stay. And then if you need it for skilled nursing facility care after the inpatient stay, and 60 days at home after you leave either the hospital or the skilled nursing facility. If after 60 days at home you are readmitted to the hospital, again as an inpatient, whether it's for the same condition or something different, you are in a new benefit period and you pay the Part A deductible a second time. It is mathematically possible to have up to 5 benefit periods in the course of a calendar year. You really have to work at it, but it is conceivable. On the other hand, you could be in and out of the hospital several times during the course of the year, but if you were never home for 60 days between the various hospitalizations, you would still be in your first benefit period and you would only pay that deductible once. So timing is everything. The Part B deductible is an annual figure, $198 this year. Almost everybody meets that deductible. It doesn't take much care to add up to $198. After you have met that deductible, then in most cases, Medicare will pay 80% of the assigned rate. the amount that Medicare says a particular service should cost, and you or your Medigap insurer will pay the 20%. People with high incomes, which is defined as over 85,000 for a single person or over 170 for a couple, will pay a higher Part B premium and a higher Part D premium for a drug plan. And as we said, the premiums and co-payments for Part D and Medicare Advantage vary widely. I expect this information about the premiums and deductibles will be announced any day now, but I'm sorry we don't have them yet. The next slide talks about Medicare preventive benefits. When Medicare began, there were very few of these, and here and there, Congress added a few, and then it added a great many under the Affordable Care Act, what's known as Obamacare. Many of these are free to Medicare recipients. In other words, they are not subject to the deductible or to co-payments. The one that's on our mind right now is the annual flu shot. This is the season when people are encouraged to get a flu vaccine to protect them as we head into the winter. Not everybody should get it, but probably most of us should. If there's any doubt in your mind, consult your doctor and remember that it will be free to you. And there are many other diagnostic tests, for instance, for heart disease and various forms of cancer. There's a lot of information about this in the Medicare and You handbook. During the COVID pandemic, that's what we're thinking about a great deal. But all those other serious health issues, cancer and diabetes and heart disease and so on, they don't go away because we're contending with COVID. They're still out there, and we need to use all these resources to guard our health. So talk to your doctor about the prevention and wellness benefits that would be advisable for you. There have been some changes or clarifications on Medicare in regard to COVID. If you need a COVID test or an antibody test, that is covered under Part B. There is no copayment for that. If you are admitted to the hospital because of COVID, your care will be covered under Part A, just the same as if you were there for any other disease. There's a greater use of telehealth services. I used to think of telehealth as what people had in Montana, where somebody might be 150 miles away from the doctor. And telehealth frequently was a good substitute for an in-person visit after a long trip. But now we're realizing that telehealth services can reduce people's exposure to possible contagion. The fewer trips we make to the doctor or anywhere else, the less the risk that we would be exposed to the virus. So it might be appropriate for you. When we get a COVID vaccine, it will be covered by Medicare Part B, not by your drug plan. Drug plan enrollees are encouraged to get refills early. Don't wait until you only have 1 or 2 pills to order a refill, because then you'll be making more trips to the pharmacy. We want to keep that to a minimum. And plans are encouraged to allow larger refills, both to reduce the frequency of people needing to go to the pharmacy and to avoid gaps in supplies. We're afraid of disruptions in the medical supply chain, and so get a larger refill and don't wait until you're down near the end. Prior authorization rules in Medicare Advantage and in Part D have been waived in many cases. Medicare fraud is another topic I just want to mention so that it's fresh in your minds. Fraud and abuse are always a serious problem because Medicare is such a big program, hundreds of billions of dollars. It's irresistible to thieves and con artists of every kind. There is so much money at stake, they just want to get a little piece of it. So don't let yourself be an unwitting party to somebody else's ingenious scheme. Don't give your Medicare number to anyone except a legitimate healthcare provider. Your doctor, the pharmacy where you get your flu shot, anybody like that who is actually providing service to you needs the number so you can, Medicare can be billed for it. Somebody who calls you on the phone, no matter how charming and pleasant they are, has no right to your number any more than you would give them your credit card number. Hang up on those people. If you get such a request by email, delete it. Medicare is not going to ask for your Medicare number. They know your number. They assigned it to you, and they keep very good records. So don't worry about being polite. Just hang up on those people. Review your Medicare summary notice carefully. That's the document you get periodically that tells you all the services that you have received and what the provider billed, what Medicare allowed, what Medicare paid, what you or your supplemental insurer are responsible for. If there's something on there that looks questionable, go ahead and ask a question. The people who do doctors' billing services are very conscientious and capable, but they're not infallible. If there is a mistake, they will be glad to correct it and be grateful that you called it to their attention. But sometimes there's something on there that's not a mistake. It's a fraudulent bill. A doctor, for instance, might bill you for a service that you didn't receive, or exaggerate the cost and complexity of a service that you received. And in that case, that's fraud. So if you have a question that you don't feel you've had a satisfactory answer to, call the Senior Medicare Patrol, and I've given you their phone number, 800 number, and they will help look into the situation for you. And finally, I've given you a list of information sources. At the federal level, here's the number for Medicare and their website. For Social Security, at their website and their phone number. During the pandemic, Social Security offices are open, but they are not open to the general public. That is, the staff is working there, but you can't make an appointment and go in. You can conduct most business by telephone or email. So the help is available. It's just a little more complicated in how to get it. At the state level, on the next slide, I give you the name and website for the Illinois Department on Aging and for the Senior Health Insurance Program, SHIP, which is a division of the Department on Aging. SHIP is the group that prepared that supplement comparison guide. SHIP exists for the sole purpose of helping Medicare participants understand their benefits, enroll correctly, use their benefits wisely, answer their questions, solve their problems. It's not steering you to anything. It's just a wonderful resource to have available. And there are SHIP sites in every county in the state, including 3 here in Will County. And the next slide lists the area agencies on aging. Mine, Age Guide for Northeastern Illinois, serves 8 counties, including Will County. There are 2 in Cook County and 10 downstate, and comparable agencies all over the country. No matter where you live, you're in the domain of an area agency on aging. And the last slide lists all the 3 SHIP sites in Will County. There is the Senior Services Center in Joliet. There is the Disability Resource Center also in Joliet, and the Seniors Assistance Center at St. Paul's Church in Peatone. So all of those SHIP sites are available to help you. And especially they are geared up to do it now during the enrollment period. The enrollment period runs until December 7th. But please don't wait until December 7th or even December 6th to call to make an appointment. By then they will be exhausted and fully booked. Call now and make an appointment. Most sites are not allowing walk-ins or in-person appointments. They're doing most of this counseling over the phone or by email, which is very effective but takes a little longer. So call now, don't wait until December to request some assistance. So that is my short update on Medicare. I'm sorry we don't have those cost figures for next year, but it should be announced any day. So watch your newspaper or listen to the news, and you'll probably be able to fill in those blanks yourself within a few days.
Loretta, thank you. Yeah, thank you so much. You're amazing. That was so much good information. I love that you included information on COVID. So I thought that was a really good part of the presentation because I think that's questions people will have. And then if you get those updated numbers, do you think you would email them to me and then I can send that out as well?
I will be happy to.
Okay.
I'll send you the whole thing with that slide filled in.
Perfect. Thank you. Really, thank you so much. It was awesome. I'm going to stop the recording. And then this is what I will send out to our group. I hope you are all doing well. I hope you're all in good health and that you enjoyed this presentation. I certainly did, and I learned some things. And we will be discussing what maybe we'll do as a December meeting, maybe something on holiday safety and being safe. And I also love that Loretto included that in her group. in her message about Medicare fraud and how to protect yourself from Medicare fraud. So I thought it was excellent. Again, if you guys need anything, reach out to me or Deputy Jers or Officer Boardman. We're happy to help in any way. And I hope everyone is doing well. Thank you again, Loretto.
You're very welcome.
All right, take care, everyone.